Let's continue with diagnosis according to Zhang Fu organ patterns. Now let's talk about lung dryness. The lung is the only Zhang organ that is in direct contact with the environment outside of the body. This means that the lung is very vulnerable to dryness because it will injure the fluids and the yin aspect of the lung. In many parts of China, the climate in the autumn is very dry. This resonates with autumn being the season where lung imbalances can be more common. Lung dryness is a precursor of lung yin deficiency. The difference being that in lung dryness, there are signs of dryness without there being decidedly yin deficiency symptoms. Now, for its etiology, in Northwestern Europe, lung dryness is not specifically related to a particular season. It can be experienced in the northern Scandinavia and mountainous areas in the winter when their air is extremely dry and when it is very cold. Dryness can be experienced throughout the year in buildings with very dry indoor climates, especially in concrete buildings with central heating. For its symptoms and signs, there will be dry cough, possibly with dry skin and sputum. There may be pain in the chest if the cough is bad. There will be dry mouth, dry throat, dry skin, thirst, hoarseness, dry tongue. The pulse can be rapid or it may be fine in the right tune position. For the key symptoms, dry, ticklish cough, hoarseness, dry mouth, dry nose, and dry throat. The treatment principle, we moisten the lung and nourish lung yin. For the acupuncture points, we may choose from lung 7, lung 9, RAN 5, RAN 12, kidney 6, and stomach 36. And we use the tonifying needling technique. So for the explanation on the choices of points, lung 9 nourishes lung yin and jin ye. RAN 4 and kidney 6 nourish yin and jin ye. RAN 12 and stomach 36 nourish stomach yin, which is the root of jin ye. Lung 7 and kidney 6 open RAN mai and yin shao mai, nourish yin, and thereby lead yin fluids up to the lung, mouth, throat, and respiratory passages. For irrelevant advice, the advice given for patterns of lung yin deficiency will also be relevant where there is lung dryness, especially the advice not to stay in places where the air is very dry. Lung dryness can be caused by stomach yin deficiency or lung yin deficiency, and in turn, it can result to lung yin deficiency. To summarize, wind dryness invading the lung has its etiology in exposure to climatic wind and heat. Its signs and symptoms are dry cough without phlegm, with scanty phlegm not easily expectorated, an aversion to cold, fever, dry throat, tickly throat, dry nose, dry lips, discomfort in the chest. The pulse will be floating and the tongue will be red with yellow or white fur or coating. For the treatment principle, we clear dryness, moisten lung, suppress cough, and transform phlegm. For the acupuncture treatment, we use lung 7 to release the exterior and expel wind, Sanjiao 5 to expel wind and release the exterior, spleen 6 to supplement the body's yin, bladder 13 to supplement lung qi, Li4 to release the exterior, RAN 12 to descend rebellious qi, bladder 12 to expel wind, kidney 6 to disinhibit the throat. We needle with drainage. For generalized sweating and aversion to cold, we could drain bladder 12, GB20, and bladder 11. Thank you for your attention.